deep breath in, and as you exhale, let any tension melt away. Today we're going to talk about sunscreen, not with fear or anxiety, but with understanding, wisdom, and gentleness. Sunscreen is the single most important anti-aging product you can use. It's more effective than any serum, any cream, any treatment. It protects your skin from damage before that damage occurs, which is infinitely more powerful than trying to repair damage after the fact. But let's approach this topic with balance. The goal isn't to make you afraid of the sun or to create anxiety around sun exposure. The sun provides vitamin D, supports your circadian rhythm, and contributes to your overall well-being. The goal is simply to protect your skin so you can enjoy the sun safely and sustainably throughout your life. Let's start by understanding what sunscreen actually protects you from. The sun emits different types of ultraviolet radiation. The two that affect your skin are UVA and UVB rays. Think of UVA as A for aging. These rays penetrate deeply into your skin and cause premature aging, wrinkles, and dark spots. They're present all day long, every day, even when it's cloudy, even in winter. They can even penetrate through windows. UVB rays, B for burning, are the ones that cause sunburn. They're strongest during midday hours and in summer months. While UVA rays affect the deeper layers of your skin, UVB rays primarily affect the surface. Both types of rays contribute to skin cancer risk. Both deserve your attention and protection. Now let's talk about the two main types of sunscreen, chemical and mineral. Understanding the difference will help you choose what works best for you. Chemical sunscreens work by absorbing UV rays and converting them into heat, which is then released from your skin. They contain ingredients like avobenzone, octinoxate, or oxybenzone. These sunscreens are typically lightweight, blend in easily, and don't leave a white cast. Many people find them more cosmetically elegant and easier to wear daily. Mineral sunscreens, also called physical sunscreens, work by sitting on top of your skin and reflecting UV rays away, like a mirror. They contain zinc oxide or titanium dioxide. These tend to be thicker, may leave a white cast, and can feel heavier on the skin. However, they're excellent for sensitive skin because they're less likely to cause irritation. Neither type is inherently better. Both can protect your skin effectively when used correctly. Choose based on your skin type, your preferences, and what you'll actually wear every single day. The best sunscreen is the one you'll use consistently. Let's talk about SPF, sun protection factor. You've seen these numbers on bottles: SPF 15, SPF 30, SPF 50. What do they actually mean? SPF measures protection against UVB rays. SPF 30 blocks about 97% of UVB rays. SPF 50 blocks about 98%. The difference between SPF 30 and SPF 50 is actually quite small in terms of protection percentage, though SPF 50 does give you a bit more margin for error if you don't apply quite enough. For daily wear, SPF 30 is generally sufficient if you're applying the correct amount and reapplying as needed. For extended sun exposure, especially if you're outside for long periods, SPF 50 provides extra insurance. But here's the crucial point. SPF only measures UVB protection. To ensure you're also protected from UVA rays, look for sunscreens labeled broad spectrum. This means they protect against both UVA and UVB rays. Always choose broad spectrum sunscreen. Now let's address the most common mistake people make with sunscreen: not using enough. Most people apply only about 25% of the recommended amount. which means they're getting only a fraction of the stated protection. For your face alone, you need about a quarter teaspoon of sunscreen. That's more than you think. It's approximately 2 finger lengths of product squeezed onto your fingers. For your face and neck together, you need about a half teaspoon. This might feel like a lot, especially if you're used to using less. But this is the amount that was used in laboratory testing to achieve the SPF rating on the bottle. If you use less, you're not getting the stated protection. Apply your sunscreen as the last step of your morning skincare routine, after your moisturizer. If you're using a chemical sunscreen, wait about 15 minutes before sun exposure to allow it to absorb and activate. Mineral sunscreens work immediately upon application. Don't forget areas that are commonly missed: your ears, the back of your neck, your hairline, and the tops of your hands if they'll be exposed to sun. These areas show sun damage over time, just like your face does. Reapplication is essential. Sunscreen breaks down with sun exposure, with sweating, and with the simple passage of time. The general rule is to reapply every 2 hours when you're in the sun. If you're swimming or sweating heavily, reapply more frequently, even if your sunscreen is labeled water resistant. For daily wear when you're mostly indoors, 1 application in the morning is usually sufficient. But if you're spending time outdoors, by a window with direct sunlight, or if you're out during peak sun hours, reapplication becomes important. Many people wonder, what about vitamin D? It's true that your body produces vitamin D when your skin is exposed to UVB rays, and it's also true that sunscreen blocks UVB rays. This creates an understandable concern. Here's a balanced perspective. You need very little sun exposure to produce adequate vitamin D, typically just 10 to 15 minutes a few times a week with some skin exposed. Your hands and arms during a short walk can provide this. You'll also get some sun exposure on your face before you apply sunscreen in the morning, during reapplication gaps, and from incidental exposure throughout the day. If you're concerned about vitamin D levels, consider getting them checked by your doctor. If needed, supplementation is a safe, reliable way to maintain adequate vitamin D without compromising your skin's health. Let's talk about sunscreen and skin tone. Everyone needs sun protection, regardless of skin color. While darker skin has more natural melanin, which provides some inherent protection, it doesn't make you immune to sun damage or skin cancer. Darker skin tones can still experience hyperpigmentation, premature aging, and skin cancer from sun exposure. The challenge is that many sunscreens leave a white or ashy cast on darker skin tones, which makes them unpleasant to wear. Thankfully, sunscreen formulations have improved significantly. Look for tinted sunscreens, which often work beautifully on deeper skin tones. Many mineral sunscreens now come tinted in various shades. Chemical sunscreens typically don't leave any cast at all. For those with sensitive skin or conditions like rosacea or eczema, sun protection is especially important because sun exposure can trigger flares. Mineral sunscreens with zinc oxide or titanium dioxide are often better tolerated. Look for fragrance-free formulas with minimal ingredients. Some sunscreens are specifically formulated for sensitive skin. These are worth seeking out. If you wear makeup, you might wonder how to incorporate sunscreen. You have several options. You can use a moisturizer with SPF, followed by makeup. You can use a separate sunscreen before makeup, or you can use a tinted sunscreen that acts as your foundation. Some makeup products contain SP. Welcome to this patient understanding space. Breathe deeply and know that lasting change takes time. Today we're discussing how to reduce pore congestion over time. Not overnight quick fixes, but sustainable practices that gradually clear your pores and keep them healthy. Pore congestion, those visible dark spots, rough texture, and feeling that your pores are filled with something, is incredibly common and frustrating. But here's the truth. Clear pores aren't achieved through one miracle product or aggressive treatment. They're the result of consistent patient care over weeks and months. Understanding pore congestion helps you address it effectively. Pores become congested when they fill with oil, dead skin cells, and debris. This mixture, when exposed to air, oxidizes and darkens, creating visible spots. Unlike active acne, congested pores may not be inflamed or painful. They're just clogged and visible. Some people are simply more prone to pore congestion due to genetics, oilier skin type, or larger pore size. You cannot change your pore size. That's determined by genetics. But you can keep pores clear regardless of their size. The long-term approach to reducing pore congestion combines regular exfoliation, oil control, thorough cleansing, and lifestyle factors. Let's explore each. Regular chemical exfoliation is the cornerstone of managing pore congestion. Chemical exfoliants dissolve the dead skin cells and debris that clog pores, working more effectively and gently than physical scrubs. Salicylic acid, BHA, is particularly effective because it's oil-soluble and penetrates into pores. Use a product with 0.5 to 2% salicylic acid 3 to 4 times per week. This could be a toner, serum, or leave-on treatment. Apply salicylic acid to clean, dry skin. Wait a few minutes for absorption before applying other products. With consistent use over months, you'll see gradual reduction in visible congestion. AHAs like glycolic or lactic acid exfoliate the surface, preventing dead cell buildup that contributes to congestion. Use 5 to 8% concentration 2 to 3 times weekly. You can alternate AHAs and BHAs, or use one consistently based on your skin's response. Don't over-exfoliate hoping for faster results. More is not better. Excessive exfoliation damages your barrier and can actually worsen congestion by triggering more oil production. Stick to 3 to 4 exfoliation sessions per week maximum. Retinoids increase cell turnover, preventing pores from becoming clogged in the first place. Over-the-counter adapalene or prescription tretinoin, used consistently over many months, significantly reduces pore congestion. Start retinoids slowly, 2-3 times per week, and build tolerance. Results appear gradually over 3-6 months. Patience is essential. Cleansing thoroughly but gently prevents new congestion. Use an appropriate cleanser for your skin type. Gel cleansers often work well for congestion-prone skin. Double cleansing in the evening ensures complete removal of sunscreen, makeup, and the day's oil and debris accumulation. Start with an oil-based cleanser to dissolve sunscreen and excess sebum. Then follow with your regular cleanser. However, cleanse only once daily. Over-cleansing triggers more oil production, potentially worsening congestion. Clay masks once or twice weekly help absorb excess oil and draw out pore congestion. Use masks with kaolin or bentonite clay. Apply to congested areas. Leave for 10-15 minutes until dry, rinse, and moisturize. Clay masks provide temporary improvement and support your ongoing exfoliation routine, but they're not a complete solution alone. Oil cleansing or gentle facial oils can paradoxically help congested pores. Certain oils, jojoba, grapeseed, rosehip, can help dissolve hardened sebum and debris in pores. Massage a few drops onto dry skin for several minutes, then rinse or wipe gently. This won't work for everyone, particularly very oily skin, but some people find it helpful for stubborn congestion. Lifestyle factors affect pore congestion significantly. Diet influences oil production and inflammation. Some people find dairy or high glycemic foods worsen their congestion. Consider tracking your diet and skin response to identify potential triggers. Stay hydrated internally. Well-hydrated skin maintains better oil balance and cell turnover. Manage stress, which increases cortisol and oil production. Regular stress management practices help regulate sebum production. Keep everything clean, pillowcases, phone, makeup tools, to prevent reintroducing oil and bacteria to clean skin. Don't expect instant results. This is crucial to understand. Pore congestion develops over time and clears over time. You're essentially training your pores to stay clearer through consistent practices. In the first 2 to 4 weeks, you may see minimal visible change or even some purging as exfoliants bring deeper congestion to the surface. This is normal. Continue your routine. At 6 to 8 weeks with consistent care, you should start noticing improvement. Texture becomes smoother, visible congestion lessens, new congestion forms less frequently. At 3 to 6 months, significant improvement becomes apparent. Your pores look clearer, feel cleaner, and stay clearer with continued maintenance. This timeline requires patience. Don't abandon your routine after 2 weeks because you don't see dramatic change. Pore congestion is a marathon, not a sprint. Take monthly photos to track progress. Day-to-day changes are imperceptible, but monthly comparisons show the gradual clearing. Maintain your routine even after seeing improvement. Pore congestion isn't cured, it's managed. When you stop your exfoliation and care routine, congestion gradually returns. Think of it like brushing teeth. You don't brush for 6 months and then stop because your teeth are clean. You continue brushing to maintain cleanliness. Pore care works the same way. Don't chase every new trend or product. Once you find a routine that's gradually clearing your congestion, stick with it. Constantly changing products prevents you from knowing what actually works. Professional treatments can accelerate results. Regular facials with professional extraction, performed by trained estheticians, help clear stubborn congestion that topical care alone doesn't resolve. Chemical peels provide deeper exfoliation than home products. A series of professional peels can significantly improve congestion. Then home care maintains results. Discuss with a professional whether these treatments would benefit your particular congestion. Adjust your expectations. Even with perfect care, you may always have some visible pores in certain areas, particularly your nose. Completely invisible pores aren't a realistic goal. Clear, healthy pores that aren't packed with visible debris is the achievable, appropriate goal. Remember that genetics play a role. If you have naturally larger pores, they'll remain larger even when clear. This is normal and fine. Healthy function matters more than size. As we close, embrace this truth. Reducing pore congestion is a gradual process requiring consistent exfoliation, proper cleansing, patience, and realistic expectations. There are no overnight solutions, but there are effective long-term strategies. May you develop patience for gradual clearing. May your consistent care yield visible results. Hello, and welcome to this peaceful moment just for you. Take a deep breath in and gently release it. This is your time to learn about caring for your skin in the most gentle, loving way possible. Today we're going to talk about the beautiful basics of skincare, the foundation of healthy, balanced skin. There's no rush, no pressure, just calm guidance as we explore together how to nurture the skin you're in. Your skin is remarkable. It's your body's largest organ, and it works tirelessly every single day to protect you. It deserves kindness, patience, and understanding. And the wonderful news is that caring for your skin doesn't have to be complicated, expensive, or stressful. In fact, the most effective skincare is often the simplest. Let's begin with a fundamental truth. Healthy skin is balanced skin. When we talk about balance, we mean skin that isn't too oily or too dry, skin that feels comfortable, and skin that can protect itself effectively. Your skin has a natural rhythm, a natural state of equilibrium it's always trying to maintain. Our job isn't to fight against it or force it to be something it's not. Our job is simply to support it. The first step in supporting your skin is understanding that less is often more. In a world filled with hundreds of products and endless advice, it's easy to feel overwhelmed. You might wonder if you need 10 different serums, 3 types of acids, or the latest trending ingredient. The truth? You probably don't. What your skin truly needs is consistency, gentleness, and a few well-chosen basics. Let's talk about those basics now, slowly and mindfully. The foundation of any skincare routine is cleansing. Cleansing isn't about scrubbing away or stripping your skin. It's about gently removing the the dirt, the oil, the environmental particles that have settled on your skin's surface. Think of cleansing as a soft reset button. You want a cleanser that leaves your skin feeling clean but not tight, fresh but not stripped. If your skin feels squeaky clean after washing, that's actually a sign you may be over-cleansing. Healthy cleansing leaves your skin feeling soft and comfortable. Choose a gentle, pH-balanced cleanser. Your skin's natural pH is slightly acidic, around 4.5 to 5.5. When you use harsh soaps or cleansers, you disrupt this balance, which can lead to irritation, dryness, or even increased oil production as your skin tries to compensate. A gentle cleanser respects your skin's natural state. After cleansing, we move to moisturizing. Moisturizing is perhaps the most important step in your skincare routine, regardless of your skin type. Yes, even if you have oily skin. Moisture is different from oil. Moisture is water, hydration. It's what keeps your skin cells plump, healthy, and functioning properly. When your skin is well hydrated, it looks clearer, feels softer, and can better protect itself from irritation and environmental stress. A good moisturizer does 2 things. It delivers hydration to your skin, and it helps seal that hydration in. Think of it as both a drink of water for your skin and a protective barrier to prevent that water from evaporating away. You don't need anything fancy, just something that feels comfortable on your skin and doesn't cause irritation. Now, let's talk about the one non-negotiable in skincare: sun protection. Sunscreen is the single most important anti-aging skin-protecting product you can use. The sun's ultraviolet rays damage your skin on a cellular level every single day, even when it's cloudy, even when you're indoors near windows. This damage accumulates over time, leading to premature aging, dark spots, and increased risk of skin concerns. But here's the gentle truth. Sun protection doesn't have to be complicated. Find a sunscreen you genuinely like wearing, one that feels good on your skin, doesn't irritate your eyes, and that you'll actually use every single day. That's the best sunscreen for you. Apply it every morning, and if you're spending extended time outdoors, reapply every 2 hours. It's a simple habit that will serve your skin for a lifetime. These 3 steps, gentle cleansing, thoughtful moisturizing, and daily sun protection, form the core of healthy skincare. Everything else is supplementary. You don't need a dozen products. You need these basics, done consistently, with patience and care. But skincare isn't just about what you put on your skin. It's also deeply connected to how you live your life. Your skin reflects your overall health and well-being. When you're stressed, not sleeping well, or not drinking enough water, your skin often shows it. This isn't something to feel guilty about. It's simply your body's way of communicating with you. Let's talk about hydration from within. Drinking water throughout the day supports every cell in your body, including your skin cells. When you're well hydrated internally, your skin can maintain its moisture balance more easily. You don't need to force yourself to drink excessive amounts. Just sip water regularly throughout the day and notice how your skin responds over time. Sleep is another beautiful gift you can give your skin. While you sleep, your skin enters repair mode. It regenerates cells, produces collagen, and heals from the day's stresses. When you consistently get quality sleep, your skin has the time and resources it needs to maintain itself. 7 to 9 hours is ideal for most people, but listen to your body and honor what it needs. Stress affects your skin in profound ways. When you're stressed, your body produces cortisol, a hormone that can increase oil production, trigger inflammation, and impair your skin's healing ability. Finding ways to manage stress, whether through deep breathing, gentle movement, time in nature, or simply allowing yourself moments of rest, is truly a form of skincare. Your diet matters too, though not in the extreme ways you might have heard. You don't need a perfect diet to have healthy skin, but generally eating a variety of whole foods, including fruits, vegetables, healthy fats, and adequate protein, gives your skin the nutrients it needs to thrive. Foods rich in antioxidants, like berries, leafy greens, and nuts, are particularly supportive of skin health. Now, let's address something important: patience. Healthy skin is not achieved overnight. It's not created by a single magical product or a dramatic routine overhaul. Healthy skin is built gradually through consistent, gentle care over weeks and months. Your skin cells naturally renew themselves approximately every 28 days. This means that any changes you make to your routine won't show full results until at least a month has passed, and often longer. This is why consistency matters so much more than perfection. It's better to use a simple, gentle routine every single day than to have a complex routine you only follow sporadically. Build habits that you can sustain. Choose products that you genuinely enjoy using. Make skincare a moment of self-care rather than a chore. As you develop your skincare practice, pay attention to your skin's signals. Healthy skin should feel comfortable. It shouldn't burn, sting, or feel excessively tight. A little tingling from certain active ingredients is normal, but pain or intense discomfort is always your skin's way of saying, "This is too much." Honor those signals. pull back when needed. Your skin will tell you what it needs if you listen gently. Remember that your skin will change throughout your life. Hormones, seasons, stress levels, and aging all affect how your skin behaves. What works perfectly in your 20s might need adjustment in your 30s or 40s. This isn't failure. It's simply your skin evolving and your skincare practice evolving along with it. Stay curious and willing to adapt. One more essential truth. Comparison is the enemy of skin health. Your skin is unique to you. It has its own texture, its own tone, its own patterns and behaviors. Comparing your skin to edited images on social media or to your friend's skin will only create unnecessary stress and dissatisfaction. Your skin at its healthiest is simply your skin, not someone else's ideal. As we come to the end of our time together today, let's return to where we began. Simplicity, consistency, and gentleness. These are the three pillars of healthy, balanced skin. Simplicity means choosing a few effective products rather than overwhelming your skin with too much. Consistency means showing up for your skin every day, even when you're tired, even when you don't feel like it. Gentleness means treating your skin and yourself with patience, kindness, and respect. You now have the foundation. You understand the basics. Trust this knowledge. Trust your skin, and trust that with time, gentle care, and patience, you can support your skin in being the healthiest version of itself. Take one more deep breath in and release. You're doing beautifully. Thank you for spending this peaceful time learning about caring for your skin. May your skincare journey be gentle, joyful, and kind.